This is repeated movements for those who have a directional preference. Directional preference for extension. Patient is in a standing position with their hands on their hips and gently move into a repeated extension moment. Some find it easier to place their hands in the small of their back and perform repeated extension from this position. Consistently assess symptoms to be sure they do not peripheralize. If so, discontinue immediately. An alternate position for repeated extension is against the wall. Hands supported. Move the hips towards the wall. Consistently monitor symptoms to be sure peripheralization is not occurring. If so, discontinue. Finally, prone press-ups is a good alternative for repeated extension. Begin with a small range of motion, increasing to mid-range of motion, and finally to full extension. Consistently monitor symptoms to be sure they are not provoked. So, directional preference for flexion. Patient is in a supine position. They draw their knees towards their chest and perform this repeatedly. Consistently monitor back and leg symptoms to be sure they are not provoked. To further facilitate flexion, the patient can pick their head up and further move into trunk flexion. Finally, an alternate position is in sitting. The patient can lean forward into trunk flexion, and they can increase the range by reaching further between their knees, ultimately attempting to reach towards under the table. Discontinue if symptoms are provoked.